How was everybody? Nice weekend? Cold weekend? It's time to dress a little warmer in this lecture hall. Bring a blanket. You can bring some slippers if you need, or a scarf, beanie cap. What are rotten eggs, rotten fruit, and spoiled milk? What are rotten eggs, rotten fruit, and spoiled milk? Groceries. What type of dance do teachers like best? Don't worry, I'm not going to demonstrate. What kind of dance do teachers like best? Attendance. What stays in a corner but travels around the world? Stays in a corner but travels around the world. A stamp. Well done. And this was a submission by one of your colleagues. Did you hear about the claustrophobic astronaut? They needed space. Okay, I thought it was good. They'll name anonymous in case you didn't like it. Okay, we're shifting gears, central nervous system, over the next 3 lectures. So today, Wednesday, as well as Monday. And then what happens a week from Wednesday? Exam 3. Okay, so that'll be over muscle physiology and central nervous system. There'll be some review, a couple of questions on review, maybe 5, 6, 7 questions on review. Nothing crazy. All right, any questions before we get started? So the brain and the spinal cord. We're going to start with the brain, but the brain and the spinal cord make up the central nervous system. And this is an arbitrary delineation. I think I've mentioned this a few times in this class. Like where the central nervous system ends and where the peripheral nervous system begins is relatively arbitrary. In fact, in a couple of weeks, you're going to do brain dissections in lab. Right? You're not there yet. You're not talking about brain yet. We're a little bit ahead, but the sequence will happen. You're still working through muscles, right? Learning muscle groups. We just left muscles. So you're going to dissect brains, and you're going to be able to see probably cranial nerve 1 and cranial nerve 2 coming out of the brain. And these cranial nerves are actually technically not part of the central nervous system because they're in the periphery. But you see them when you look underneath the sheet brain. So we're going to talk about them in brief in this section, but they're really considered part of the peripheral nervous system. That's an example that I like to use because it's really arbitrary. Like who decided that cranial nerves are not part of the CNS and they're part of the PNS or the peripheral nervous system? Make sense? But categorically, it's important for you to know where these delineations are so that we can talk about them, we can study them, and then, of course, so I can ask test questions. But the central nervous system has been a topic of study in neuroscience for a long time. And we've been fascinated with the human brain. We've been fascinated with what it does, how it's organized, when things go wrong. The memory capacity of the human brain has recently been mapped and is 2.5 petabytes. Anybody know what a petabyte is? It's about 1,000 terabytes or 1,000,000 gigabytes. So that's the memory capacity of our brains. I'm somewhat convinced in the future we're going to have sort of USB ports or some sort of, ability to upgrade that memory capacity, maybe in your lifetime. And this is where science fiction kind of starts playing, right? You've seen a lot of these kinds of movies. We've been fascinated with this for a long time. Now, There's a slightly older survey in the late 2000 teens that actually documented that about 65% of Americans believe that we only use 10% of our brains. How many of you have heard this? We don't use all of our brain. Right? So that's actually a myth that we only use 10%. Do we use 100%? Likely no. Does everybody use 100%? Likely very much no, right? I mean, the guy that cut me off coming to the university this morning definitely didn't use 100% of his brain. So this has been a fascination of ours for a long time. Is the brain underutilized? Yeah. Is it 90% available that we don't use? No. In this recent study in a neuroscience journal actually documented that. And there was an interview with a neurologist named Barry Gordon in Scientific American that actually discussed this and talked about this. The study, The Myth Buster, was published in Neuroscience, Human Neuroscience, and debunked. So no, we don't use only 10%, but do we use 100%? Absolutely not. And so this has been the source of like a number of different sci-fi movies or curiosities.
Maybe it's time to let the writing go. Just in case you think nothing ever happened to me. Hey, Mara! Hey, tell me about this book. Why don't you hear it? One word. Well, I suppose I can help you with that. You know how they say that we can only access 20% of our brain?
20%.
Access all of it. They done clinical trials and it's FDA approved. All right, just out of curiosity, and that's all. I was blind, but now I see. A tablet a day, and I was limitless. I now had cultural appetites. Since when do you speak Italian? I finished my book in 4 days. I like to renegotiate my advance. Math became useful. From 12,000 to 2.3 million in 10 days. I'm baffled by this guy. So, Eddie Mora, you do know you're a freak. What's your secret? Medication. Powers are different. I will get my script. I'll open up my credit for you. One of your few toys. How many of us ever know what it is to become the perfect version of ourselves? What's the asking price? $12.25. I'll take it. Everything I have, I want to share with you.
Yeah, man. You think somebody's watching?
My brain is skipping time. I have no memory of the last 4 days. My powers are not earned. You're clueless with those powers. Have you asked yourself what you're going to do when you run out? You'll die. There's no scenario in which you lead this life. You don't work for me. No scenario. I see every scenario. I see 50 scenarios. That's what it does, Carl. It puts me 50 moves ahead of you. Or risk. What would you do?
All right, you get the idea. How many of you seen this movie? Pretty clever, pretty interesting, but it's sort of an old concept. This concept of we only use a limited amount of our brain. There's no magic pill. There's not an FDA approved drug. Sigh, 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 right? But you can exercise the brain. You really can. And there's other examples clinically where we have post-stroke patients and certain portions of the brain are damaged and non-recoverable. And the brain is plastic enough, and we'll talk about neuroplasticity, that it actually can find new routes and send signals to the same centers that are not damaged by the stroke and reintroduce functionality over a period of time, over a period of training. And that's part of what physical therapists do with post-stroke patients. Okay? Is it a cure? No. Is it 100% successful? Never. Okay, but there is some plasticity. There is some rerouting, kind of like when you make a wrong turn and your maps reroute you at your earliest convenience, take a right or a left or whatever it is. So this curiosity of the brain, how much do we use? How much do we know about it? The conscious versus the unconscious. It's actually been this topic of neuroscience for decades. So we're going to dive into kind of how it's organized, how it's mapped, the different centers and what things do over the next 3 days. We'll work our way down from the brain and we'll talk about its organization, which is quite fascinating. We'll talk about left and right hemispheric organization. We'll talk about posterior to anterior organization. We'll talk about top down, or what we refer to as rostral to caudal. And then as we move down from the brain, we'll go to the brainstem and then into the spinal cord. And together, all of those structures make up the central nervous system. Okay? Make sense? So, first off, we have a right and we have a left hemisphere, a right and a left side. It's actually like two brains, and they're connected via myelinated white matter tracts through the corpus callosum that allows the two brains to communicate on a regular basis. There are centers for certain activities in the left side, and there's other centers for other activities in the right side. And we have a coordinated effort as it works together. Now, the brain actually has these gyri, which is the plural form of a gyrus. And these are these sort of bumps that you see, the raised portion of the brain. And then it has these valleys or these invaginations known as sulci. Sulcus is singular, and that's the infold that comes in. And what the gyri and the sulci do is increase surface area of the brain. And in one way that we look at sort of higher ordered mammals, which is sort of a debatable use of the terminology any longer, but in higher thought processes, or mammals that are capable of higher thought processes, we see more gyri and more sulci, or a greater surface area. You can pack more of the neuronal matter into the brain if you increase the surface area. Now, the white matter is myelinated, and we haven't talked about myelin yet. We've alluded to it, but myelin is a fatty proteinaceous covering over the nerve that increases the speed of the action potential. And we'll study it in more detail a little bit later in nerve physiology. And we'll look at some of these demyelinating diseases like MS. In fact, you'll read a paper on MS. And the white matter that has myelinated tracts move much faster, the electricity. The electrical signal moves much faster down myelinated tracts. You remember that electricity that comes down the neuron when we were in the last unit, and it interfaces at that neuromuscular junction? So the speed at which that signal comes down a myelinated fiber is much, much faster. Now, the white matter forms these bundles of axons collectively that make up what we refer to as tracts. Like the corpus callosum is one of the biggest tracts of white matter that connects the left and the right hemispheres. And the gray matter is unmyelinated, and it forms a bulk of the material in the brain. These are neuronal cell bodies and dendrites, as well as synapses, that forms the cortex over the cerebellum, as well as the cerebrum. Now, cell bodies, dendrites, and synapses, these are terms that we have kind of loosely discussed when we talked about histology. We'll talk about it in more detail in nerve physiology, but these are portions of the nerve itself. The cell body is where the nucleus is located. The dendrites are what receive the electrical signal, and then the axons what transmits it downstream, like to the neuromuscular junction. So if you look at a top-down view, And this is gross anatomy or macroscopic. That's another term of gross, like the joke, groceries. Right? So the term gross is actually macroscopic. Things that you can see with your own eye. So when you talk about gross anatomy, you talk about things with an unaided microscope. Not microscopic anatomy, but macro anatomy. So if you look at the top-down view, you can appreciate this longitudinal fissure that comes anterior to posterior. You can appreciate where this term cerebral hemispheres, this is the anterior or the front portion, and this is the posterior portion. So this is where the occipital lobe sits in the back. You move from posterior to anterior, you hit the parietal lobe, and then you move over to the frontal lobe. And we'll talk about all these different lobes and what sits within or what resides within these lobes. Another view of just the surface topography of these gyri and sulci with the goal of increasing surface area. Now, if we go superficial to this, underneath the cranial cap, this brain is actually protected and surrounded by tissue. And the tissue that sits over top of it immediately are known as the meningeal layers or the meninges. And there's 3 specific layers or meningeal layers. And as you move from deep to superficial, we're going to go backwards because we're moving this direction. The first layer that actually touches the brain is the pia mater. And then you move into what we refer to as the arachnoid mater. And then you move to the dura mater, which is the superficial most layer of the meninges and just deep or just beneath the skull cap. The subarachnoid space is an area that circulates cerebral spinal fluid. And we're going to talk here in a minute about cerebral spinal fluid and its functions. So within the brain structure itself, we have these chambers known as ventricles. And that's the terminology that translates directly. A ventricle is just a room or a chamber, an area or a space. These are housed within the brain, and I'll show you a picture in a second. We have two lateral ventricles in the left hemisphere as well as in the right hemisphere. And then they actually connect to a mid-portion third ventricle, which then connects to a mid-portion but slightly inferior fourth ventricle. And the whole idea is within the ventricles is where this cerebral spinal fluid is manufactured or made. Now, similar to sweat glands, where we said that sweat glands make sweat from what? How is sweat manufactured? From the bloodstream, from blood. It's filtered blood. Cerebral spinal fluid is also filtered blood. It's filtered in the ventricle system. So blood flows into the choroid plexus of the ventricles, is filtered, and the red blood cells are left behind. And what you receive is a nutritional plasma fluid that's clear, colorless, and odorless. But it has a lot of the nutrition that the brain tissue needs. So if I show you this picture of the ventricular system, this is an anterior view, this is a left lateral view. So if we're looking at the anterior view, this is a lateral ventricle, this is a lateral ventricle. So this would be the patient's left lateral, the patient's right lateral, which these dump into or connect to right here. They connect to this third ventricle. which connects to, right here, via the cerebral aqueduct, the fourth ventricle. And the fourth ventricle feeds down the central canal, which runs all the way down the spinal cord. And as it's manufactured in this ventricle system, every one of these ventricles makes a little bit of cerebral spinal fluid, puts it into circulation, and then it flows out of that central canal and eventually back up into that subarachnoid space of the meningeal layer. So it is literally inside and bathing the entire central nervous system. So the fall analogy that I use is if you have a very delicate organ as the brain and spinal cord, and you're going to protect the brain by having it in a cranial cap, and you're going to have this vertebral column that protects the spinal cord. Inside of that, this is like the ultimate Amazon Prime packing job. You have a fluid that it floats in and literally bathes the entire tissue during transport, which is every day, right? You're transporting around your brain and spinal cord. So like apples in a barrel of water that just kind of bob and float, that's kind of the analogy that your brain is and the spinal cord sitting in its spot within the body. It's suspended ever so slightly in a fluid media. Make sense? So if you turn to a lateral view, you can kind of see these structures and how they connect lateral, to the third ventricle, down to the fourth ventricle, and then down the central canal. And because the brain is so highly metabolic, especially in this classroom, right? You need a constant flow of nutrition and removal of waste products. So having a blood flow to the brain tissue itself isn't enough. You have a secondary fluid that actually contributes nutrition and removes waste products, and that's the cerebral spinal fluid that recirculates. It comes from the bloodstream, but it actually infiltrates the brain tissue separate from a vascular supply. Questions? Okay, so let's take a look at this. This is a clear liquid that fills the ventricle canals and bathes the external surface of the brain. You manufacture about 150 milliliters of cerebral spinal fluid, and it circulates and replenishes about once a day. So at any given time, 150 mils of fluid, which is not much, is what is within the ventricular system in the subarachnoid space. So it provides a buoyancy of the brain. Brain essentially floats in the cranial cap. It cushions the brain, provides protection, and it creates this chemical stability or buffering capability for the brain and the spinal cord. Now, there are certain things that will impact the amount of fluid, specifically blood volume. Alcohol is one, caffeine is another. So anything that actually will encourage urination, or what we refer to as a diuretic, that lowers blood volume, that will impact your blood pressure, drop your blood pressure. That, in effect, will lower the amount of cerebral spinal fluid. And if you've heard of people that do this, they drink too much one night and the next morning they have a wicked headache. A lot of that pain is associated with pressure points of the brain as it kind of sits in the skull cap with not enough fluid to keep it floating. Okay, so IV therapy, drinking fluids tends to help kind of replenish that cerebral spinal fluid as fast as possible.
Is that why when people say, like, drink water when you have headaches,
Well, I mean, so the question is that why when people say, "Hey, drink water when you have headaches," is it normally due to the brain resting on the skull? It's not gonna fix every situation, obviously. But if you're hypohydrated, you're underhydrated or dehydrated, yeah, having fluid replenishment, especially in the Southwest, is probably really important, right? I mean, that's why we all walk around with water bottles all day, right? Okay, so let's walk through kind of the flow of cerebral spinal fluid as it makes its way through this system, this ventricular system. And then we'll look at something, of when it goes wrong or when it goes sideways. So number one, and you can see the corresponding number one here in the lateral ventricle. So the choroid plexus is a structure. Plexus means like a network of vascular elements or a network of blood vessels. So this choroid plexus that's found in all four ventricles, but it starts in the lateral ventricle, and that's where the blood is filtered into cerebral spinal fluid. And there's a very, very tight junction that exists of the endothelium at the level of the choroid plexus. And we'll talk more about that a little bit later in the semester, but the endothelium that sit within the choroid plexus have really tight junctions. So certain things cannot cross, and we refer to that as the blood-brain barrier. In fact, a lot of pharmaceuticals will not cross. Some will, but not all. And the reason for that is you want to protect the brain very, very carefully from any kind of blood infection. So if you get a blood infection, you don't want it to infect the brain. So you create a very, very tight junction at that filter known as the blood-brain barrier. And that's what we refer to as the blood-brain barrier, is this choroid plexus structure that is really responsible for manufacturing cerebral spinal fluid. So we filter the blood. The red blood cells, which are like 4 to 6 microns in diameter, the red blood cells don't even cross. So cerebral spinal fluid is clear. It doesn't look like blood, right? Just like what we said with sweat, right? The sweat that's filtered in a sweat gland is typically not bloody, right? You don't sweat blood all the time. Under extreme pathological conditions, that could happen. Under extreme pathological conditions, could you have red blood cell elements in the cerebral spinal fluid? Yes. And that would tell you there's something wrong, okay? And you probably have other things in the cerebral spinal fluid that you're not supposed to have. Maybe some viruses, maybe some bacteria. So we'll talk about that in a second. So this is like your natural protection right here. So it goes from the choroid plexus, number 2, it flows into this interventricular foramina, which is the duct that connects the lateral to the third ventricle. Then in the third ventricle, we actually add more cerebral spinal fluid, a few drops. It flows down the cerebral aqueduct, which is the duct network that connects it from the third ventricle to the fourth ventricle. And the fourth ventricle contributes a little bit more cerebral spinal fluid. So now I'm at number 5. Number 5. Fourth ventricle. So number 6, it leaves out 2 lateral apertures and 1 medial aperture. Medial is down the middle, lateral is out the sides. It fills the subarachnoid space and bathes the external surface of the brain. And number 8 is where it's reabsorbed back into the bloodstream. So at the arachnoid villus is where we actually have this superior sagittal sinus. And a sinus is just a term for an area that collects fluid and returns it back. So in this case, the fluid that's collecting is cerebral spinal fluid. It's basically dumping it into the venous circulation. So it comes from the arterial side at the choroid plexus. It's filtered. It circulates through, and then it's returned right back into the venous circulation. Okay? It's low pressure. It just kind of makes its way through, not a lot of flow. And in some circumstances, we can actually have a problem associated with the compromised flow of cerebrospinal fluid. We'll talk about that here in a second. So here's kind of a short list of this flow pattern, kind of in 6 simple steps. So the choroid plexi of both lateral ventricles make the CSF. It flows through this ductwork known as the intraventricular foramina into the third ventricle. More cerebrospinal fluid is added there. And then it goes through the cerebral aqueduct to the fourth ventricle. A little bit more fluid is added there. And then it returns to the subarachnoid space, which is between the arachnoid and the pia mater, and ultimately back into the bloodstream. So what happens when this doesn't work well? What happens when you actually make too much cerebrospinal fluid or you don't drain it fast enough? So we have a ventricular disease referred to as hydrocephaly. Hydrocephaly. Hydro meaning water, cephalus or cephalad meaning head. And so in this country, in Western culture, we don't see this very often any longer. It does show up on occasion, but we tend to treat pretty quickly. But in developing countries, this is a real problem because they don't have the pediatric care that we have in the States or in a lot of westernized countries. And so you can accumulate cerebrospinal fluid in these ventricles, causing pressure on the brain itself. And if this is a young infant, before those fontanelles close, do y'all remember when we talked about the development of the cranial bones? And in the first couple of years of life, there's soft spots of cartilage before the bones fuse. So if you have high pressure in the cranial cap, you'll actually get this swelling of the infant's head like you see in this picture. So about a third of these patients, if left untreated, would have normal intellectual function. And there's over half of these patients won't make it. The mortality rate is absolutely horrendous. And what is the solution? What is the solution? Any ideas before I get into a case study? What's the solution? What would you do? You have to drain it? You have to drain it or you have to turn off the flow, right? But if you turn off the flow, maybe you have too little now. So maybe if there's a blockage of draining it, so that's exactly what we do surgically, is we actually introduce shunts that actually are little tubes that collect the fluid and dump it back into the subarachnoid space or into the sinus, back into the venous circulation. It's actually, I mean, it is neurosurgery and it's brain surgery, but it's very superficial. It's not a complicated surgery for a neurosurgeon. So this was a case study, and I'm going to tell you right now, unfortunately, this story has good details, positive things that happen for this little girl, but the end outcome isn't great. The end outcome isn't great of this story. I've been following it for years. But this is a little girl by the name of Runa Begum. And she was in Tripura, India, and was developing hydrocephalus, overproduction of the cerebral spinal fluid, and undershunting or not returning quick enough to the venous circulation. So her head grew to about 94 centimeters in diameter, which is about 3 times the size of a normal infant's head. And her parents in India couldn't afford the surgery. Her father was a bricklayer and he earned less than $3 US a day. So they did their best to take care of her. There was a journalist group about your age in a university setting. These were Norwegian students that actually were traveling all over the world, journalists, And they ended up taking pictures of Runa and posting this and creating a crowdfunding website to raise money to actually fund her surgery. So they were hoping to raise $1,600 US to cover the entire surgery. They ended up raising over $60,000 US. She had 5 cerebral shunting surgeries to drain the fluid. So this was her at the peak. Her eyes are actually open in this image. They're just so, like everything is so swollen that she kind of looks like this. This is a picture of her right before going into the hospital. This is a picture after surgery and after recovery. She actually had 5 birthdays. So she lived to the age of 5, unfortunately, before the care ended and she wasn't able to have more surgeries. So many of you are interested in medicine. Some of you are interested in medicine that's outside of the West influence or outside of the US. And so these are the types of cases that you'll come in contact with, that you'll experience. In the US, from a pediatric medicine standpoint, you know, it's taken care of pretty quickly. But in other developing countries, these are challenges that, you know, we just have no idea. Okay, let me talk about another set of complications that associate with the central nervous system that do impact actually not just your age group, but where you are in life. Like if you live in community housing, if you live in a dormitory, if you live in military barracks, okay, if you live in tight quarters. So meningitis. So remember how I talked about this blood-brain barrier and how the integrity of the blood-brain barrier was really, really tight junctions between the endothelium that line the blood vessels in the brain to keep certain things from crossing. Well, unfortunately, if there's a compromised blood-brain barrier, you could have a blood infection that gets up to the choroid plexus and passes through into their cerebrospinal fluid. It could be bacterial, it could be viral, it could be fungal. And any one of those culprits can actually cause meningitis, which is an infection of the meninges, of the meningeal layers that we just got done talking about. So, some of the symptoms: neck stiffness, rigidity of the neck, high fever, you have an infection, a little bit of confusion, maybe some slight altered personality, people a little bit more irritable than normal. We had a close friend that this happened to, and she became extremely grumpy, and she's like a super sweet gal. So like flu-like symptoms. So it could be, most commonly, it's bacterial infections, like N. meningitis or S. pneumonia. It enters the bloodstream, comes in contact with the meningeal layers, usually out of the nasal cavity or the skin is where it originally starts, affects swelling of the brain. Some vaccines are available. Treatment is actually pretty easy, pretty fast. I said if it's bacterial, viral, or fungal, how would you actually diagnose if the patient had meningitis? Any ideas? Pull CSF fluid, right, from what we call a spinal tap. You culture it out. You test if there's bacteria. You test if there's fungus, or you test if there's a virus. And then you give antifungal, antiviral, or an antibiotic. Okay? But you actually have to have medical attention to do this. So again, in our country, not too much of a big deal. Usually you can get treated pretty fast. You'll probably not make it if you don't get treated. Now, Neisseria meningitis, or N. meningitis, this is the strain of bacteria that most commonly impacts your age group, college age group. Late teens, early 20s, or into the 30s, okay? Beyond that, most people aren't living in crowded situations anymore in their 40s and 50s, right? So N, Neisseria meningitis. So you need to know that one, because I want you to be able to distinguish between the two different strains. College age versus young and old patients are the streptococcal pneumonia, the S pneumonia. Streptococcal pneumonia is the one that targets infants or pediatric or geriatric or older patients. Okay, so remember those two different bacterial strains. Neisseria meningitis, your age group, like dormitories, military, tight quarters. And then streptococcal pneumonia, the very young and the very old. Okay, moving on. So let's talk about gray matter versus white matter. So gray matter is unmyelinated. This is the sheath that I keep talking about, right? This myelin sheath. It's basically a cell known as a Schwann cell or an oligodendrocyte. So a Schwann cell in the periphery or a oligodendrocyte here in the central nervous system. And this Schwann cell or oligodendrocyte, it actually makes extra phospholipid membrane. And that extra phospholipid membrane is a fat layer with embedded proteins. And that membrane that it makes, think about like rolling out dough. And then you're going to, put something in the middle and roll like sausage, like pigs in a blanket, where you roll the dough around it, and then you kind of get this collection of dough that goes around the sausage. That's how wrapping a neuron actually takes place. Now, gray matter is unmyelinated. Faster or slower than myelinated? Slower. So why even bother? Like someone's going to ask the question, why would you even bother making unmyelinated neurons if they're slower? Any ideas?
They take up less energy to function.
It takes less energy to make them, right? So it's biologically energetic to wrap a neuron. So if you don't need to wrap it because its proximity is relatively close, then you don't need to spend the energy getting it there faster. Does that make sense? So I mean, some of you have like Wi-Fi at home, right? You have like a 3G or you have a 5G. Does that make sense? Like you have dual Wi-Fi. And sometimes when you're streaming like 4K, you're like, I'm going to get on the network that's the 5G. But for everything else, let's use, just the standard internet speed. And so you separate out your home internet based upon the number of devices you're trying to support. And the most important ones that need the fastest is the stuff that gets the 5G. Make sense? The brain kind of does the same thing. So gray matter is the major component of the central nervous system, consisting of neuronal cell bodies, dendrites that are unmyelinated, and capillaries and glial cells. Glial cells are supporting cells. But I get a lot of questions from students like, why do we even bother having gray matter? That seems like so basic. Why don't you get like upgrade to like the Turing model, right? I want power everything. But it takes a lot of biological energy to make these. So the three regions where you're going to find the gray matter, the outer cortex, the outer layer of the cerebrum, the cerebral cortex, the basal nuclei or the basal ganglion. This is a collection of nuclei in the brains of vertebrates. We're vertebrates, those organisms that have backbones. And it has close association with the cerebral cortex and the thalamus and areas that control learning, habits, and memory. But the thing is they're all very close together. All of these things are tightly collected in the middle of the brain. Emotions, memory, cerebral thought. Now, when we see a lot of myelination is when you need to move stuff from the left side to the right side very quickly down a myelinated tract. Or you need to send motor signals from the brain out to the periphery, like to the distal extremities. And you got to go from here, all the way down there, which is like feet away from where. But if it's coming from like here and it's going to here, you don't need to myelinate that. Does that make sense? So that short distance, why myelinate it? But from here all the way down to my foot, we got to send that all the way down. That's where we use the myelin. So the limbic system, this last one listed here, this is emotion, behavior, long-term memory, olfaction. This is all part of the limbic system. So students, unfortunately, incorrectly conclude white matter is so much more important than gray matter. And that's not true. Gray matter controls most of what you do in the brain. And it's just as important, if not more important, than the white matter. It's just geographically, it's not a far distance to send the signal. So you don't spend the energy, the biologic energy, wrapping it with myelin. Okay, so now let's talk about white matter. Projection tracts. Projection tracts, they extend between higher and lower brain function and carry information quickly from one center to another. Commissural tracts, that's like the corpus callosum, that goes from left to the right. And then association tracts. Association tracts, they connect information on the same hemisphere, but it may be from the back of the brain to the front of the brain. So you're like, well, I thought if it's in the same area, it's not a far distance. Yeah, but we're not talking about, a few centimeters or a few millimeters away. We're talking like from back to front. We're still talking inches, right? And those association tracts may be things like, I heard a sound of a siren. I process the siren. I say, that's not a police siren. That's a fire truck. Where's it coming from? I need to move out of the way and move to the side of the right. All of that association is happening very quickly. Or you hear that sound, he's like, wait, is that a siren? Now you need to turn down your music, see if you can actually discriminate. Is that what I think I'm hearing? All of that's happening in seconds, right? And that's because of your ability for association tracts to move information so quickly. All right. We're going to talk ever so briefly about the cranial nerves. And the reason we're going to cover them very, very briefly is because they're on the bottom of the brain. And so I feel like it's a disservice not to at least mention them, even though technically the cranial nerves are part of the peripheral nervous system and not the central nervous system. Right? But again, this is like this arbitrary spot. So we have 12 cranial nerves. In lecture, I am not going to ask you to memorize the 12 cranial nerves. Now, I told you in lab, you'll probably be able to see cranial nerve 1 and cranial nerve 2, depending upon the sheep brain prep that you have and how they cut it out of the organism. But cranial nerve 1, right, is the olfactory nerve, and cranial nerve 2 is the optic nerve that goes to the eye. Olfaction is for smell, chemosensation of the nose, and optic nerve is for vision. Now, in this lecture class, over the next few units, we'll be talking about some of these cranial nerves in their specific space. So, yeah, you're going to be exposed to them again, but there's not going to be on exam 3, list the 12 cranial nerves. Or cranial nerve 6 does what? Like, we will come to it in lecture, and then there'll be a function associated with that cranial nerve that I'll want you to know. Okay? So, for example, eventually we're going to get to talking about the vestibular coccylar nerve, cranial nerve 8. So the vestibular coccylar nerve, cranial nerve 8, this is the vestibular apparatus in the cochlea, which is associated with special senses of the inner ear. And in the last unit, Unit 5, right before the final, we will be talking about hearing and balance. And I will talk about the vestibular coccylar nerve, cranial nerve 8, and we'll study it at that time. Make sense? So we won't ever really talk about the ocular motor nerve or facial nerve. We will reference the vagus nerve, but we won't talk about the accessory nerve. Optic nerve we'll talk about, the olfactory nerve we'll talk about. So we'll cover those when they come up in the remainder of the semester. In lab, you'll have to memorize all 12 of them, and you'll have to be able to point to them, just like on this map. Okay? Now, they're mixed. Some of these are mixed, meaning some of them are motor function, and some of them are sensory function. And motor is obvious, an output from the brain down to the periphery to move, to do some kind of activity. Sensory information is coming from the periphery, bring it into the brain to process it. Now, what I want to be able to explain to you in this next section is some of this organization of the brain. And the brain is very elegantly organized, which is quite fascinating because it's got a couple of axes that we talk about. So what I mean by that is it's organized from left to right, so my left to my right, from your left to your right. It's organized from front to back. It's organized from top to bottom. Okay, so 3 directions that's organized. So let me explain. We will start to see, if we get to it today, we'll pick it up. If we don't, we'll pick it up on hemispheric differences between the left and the right side. There are certain centers that process information on the left hemisphere. For example, logic, reasoning, mathematics are processed on the left side. On the right side, creativity, language, imagination on the right side. Now, we all have a left and a right brain. And because of the corpus callosum, they communicate very quickly. But clearly, there are people that are better at certain activities than others, or have more skill at certain activities than others, right? So those centers on their left side for math and logic and reasoning may be more developed or larger number of neuronal connections, right? And some of us can't speak a second language. In fact, like me, struggle with a first language, right? And so the language centers maybe aren't as aggressively developed in someone like myself. It's more math and science. Make sense? So left to right. Okay, back to front, or posterior to anterior. Dorsal to ventral. Sensory information comes in the brain on the posterior aspect from the periphery. It comes up and it comes in the back side of the brain. And then as it moves from back to front, it goes through these association centers of, oh, I think that stimulates a memory. Oh, I've heard that before. I've seen that before. And then the motor function comes out the front part of the brain and goes down to the body to process. So sensory information usually comes in the posterior aspect. It moves through the brain, and motor function comes out of the front or the anterior portion of the brain, back to front. Okay, top to bottom, or rostral to caudal. Caudal is what means tail, right? So if your rostral, your top, high, the forebrain, the front of the brain, and we're going to see this. And I want to tell you the organization, because if you know the map, when you see this stuff, it's easier to understand, like, oh, well, that actually makes sense. We're talking about the forebrain. That's where intellectual function is, up top. That's where intelligence, that's your personality. That's decision-making, like ethics. Like, I probably shouldn't do that. Or, I think I can get away with it. Right? That's the forebrain. As it moves towards the tail, or caudal, as it moves down, it becomes less complicated of a function and more automatic. So like, for example, in the brain stem, which is at the bottom of the brain, and it actually connects the spinal cord, the brain stem is where you have autorhythmic centers for heart rate and breathing, stuff that you don't even have to think about. So 3 ways that the brain is organized that just helps us to categorize things and helps you remember. So this picture is trying to kind of give you a map and highlight that. So here we've got the anterior portion of the brain, the posterior portion, front, back. This is the spinal cord. So we have the forebrain that's made up of the diencephalon and the telencephalon. And these are embryonic structures during development that give rise to the name of that tissue. So the forebrain is made up of these 2 tissues, the diencephalon and the telencephalon. That's the forebrain. That's anterior and actually the most top. Then we have the midbrain, also referred to as the mesencephalon. And then we have the hindbrain. The hindbrain is made up of the pons and the cerebellum, which is really the metencephalon, and then the medulla oblongata, which is the myelencephalon. So that's at the level of the hindbrain, or what we refer to oftentimes as the brain stem. Okay, so we're going to walk through these one at a time. The forebrain. Forebrain is the cerebrum and the diencephalon. So we have our cerebral lobes. Now, conveniently, these cerebral lobes are made or named after the cranial bones that protect them. So if you studied the skull, when it comes to the brain, it should be familiar. The frontal lobe, conveniently colored in blue. So now this picture is flipped from the last image. You're looking at the left side of the brain. This is anterior, this is posterior. This was anterior, this is posterior. So we're flipped. Oops, sorry. My bad. We've got the frontal lobe in blue. We have the parietal lobe in purple. We've got the temporal lobe in yellow, and we've got the occipital lobe in green. So between the frontal and the parietal lobe is this lateral sulcus. You see that? So right here is this lateral sulcus, and the anterior portion, this is the precentral gyrus, and this is the postcentral gyrus, because this is a gyrus, right? It's a bump. And this is our central sulcus. So if we're before the sulcus, precentral. If we're behind it, it's postcentral. I told you sensory is where? Towards the back, and motor is where? Towards the front. So does it surprise you to know that the postcentral gyrus is where a lot of what is processed? Sensory information. And that the precentral gyrus in the front is where a lot of motor decision making is happening. So the frontal lobe. Higher thought. The central sulcus is this posterior border of the frontal lobe, and the primary motor cortex, known as the precentral gyrus, is part of that frontal lobe, involved in motor function. So one particular area that I want to highlight is this area known as Broca's area. So here's our primary motor cortex. It's in the frontal lobe toward the front of the brain. On the left side of the brain, a little bit in anterior to the primary motor cortex, also referred to as the precentral gyrus, is this area known as Broca's area. Now, damage or trauma to Broca's area. Broca's area was discovered as a center that's important for the formation of words or the formation of speech. So it's a motor function, right? Because it's in the front. So if there's a stroke, if there's a head injury, if there's a contusion to Broca's area, you have a language disorder, and these individuals completely understand what's being said, but they have a very difficult time saying a word. The motor activity is compromised. There could be stuttering. There could be a difficult search for the word, can't place the word. Broca's aphasia. Causes. Stroke, we talked about that. Very common in stroke patients to have a speech impediment post-stroke. Can't formulate the words. They get frustrated because they know what you're saying. You ask them a question, they could write it out with their non-stroke arm. They could write it out, they could type it, they want to say it, and they have trouble communicating with the motor function of making the word. Okay? Traumatic brain injuries, a brain tumor, or any kind of brain infections. Neurosurgery that would be in the brain for cancer, and they take too much healthy margin, and they compromise a portion of Broca's area, and now the patient has an aphasia. These are all common things that can happen. Okay? The parietal lobe, posterior, processing things, not motor, but processing things what? Sensory. So integrate sensory information, conveniently colored in purple on this slide. The primary somatosensory cortex, known as the postcentral gyrus, is just posterior to the central sulcus. And this area here, again, this is the left side, the left parietal lobe. There's an area known as Wernicke's area. This controls the understanding of spoken and written words. A Wernicke's aphasia, same kind of injuries could cause this. These individuals, they can actually make the words just fine. In fact, they may not stop talking. They may just run with their mouth. But the comprehension or the communication of what those words really mean are sort of just gibberish. So they're aware that they're speaking, but they may not be able to stop themselves or even understand what they're saying. There could be profanities that happen here, right? With these types of injuries. Same typical suspects: stroke, head injury, brain tumor, brain infections. Temporal lobe, on the side, on the temple. Allows for auditory, olfactory, and gustatory interpretation. Gustatory is taste. We'll come back to taste in the last unit with special senses. The lateral sulcus separates the frontal and the parietal lobes from the temporal lobe. The back, the occipital lobe. Visual acuity. Sensory information because it's visual, right? So while the eyeballs are in the anterior aspect, the information is processed back here. So a strike to the back of the head and the concept of seeing stars if you don't black out, these are nerves that have been triggered to stimulate and fire because you've smacked them and they're flashing signals, and you're interpreting that as I'm seeing bright lights, even though you're not actually seeing anything. You've actually bypassed the eyes, and you've just struck the nerves on the back of the occipital lobe. So the precentral gyrus and the postcentral gyrus gets a lot of attention, And we've talked about this sort of hemispheric, three-axis, caudal to rostral to caudal, and then posterior to anterior. And now we're going to kind of dive into the pre and the post-central gyrus in a little bit more detail, which is quite fascinating. So you're going to see in a lot of textbooks this terminology referred to as a homunculus. So what this is depicting is the sensory information on the left, which is the post-central gyrus, and the motor information on the right, which is the pre-central gyrus. And it's trying to give you an indication of the relative amount of neuronal space that is taken up in those particular areas for certain neurons that control certain parts of the body. So, for example, let's focus on sensory. If you're looking at this slide here, the sensory is the post-central gyrus, which is this. That is what this is showing. And you can kind of appreciate that the relative amount of neuronal space for the scapula in comparison to the amount of space for sensory information of the fingers and the hands. Or just the face, right? You can feel lots of different sensory discriminations on the face. But on the scapula, just, on the underside of your shoulder, I mean, someone might tap you and you may notice it, right? Someone comes and flicks your face, you're going to pay attention, right? Pulls on your ear, you'll notice it. So kind of the same with motor. I mean, look at the amount of real estate for the tongue, because speech is so important to us. Formation of words. Same thing with facial expressions or the ability to control the hand. And again, the relative amount of the scapula, or the knee in comparison to the hand, the face, or the tongue. So the homunculus is just a depiction, an artistic representation of what neuronal real estate is designated to different functions with respect to sensory and motor. Does that make sense? Okay, so we're going to cover a couple more topics and then we'll hit the pause button as we run out of time today. But I want to cover the limbic system, and then we're going to talk and end with hemispheric specialization, which I've already indicated, or I've already kind of talked about enough, and we'll kind of finish out that story. So the limbic system is a really interesting structure. It's made up of three specific portions of the brain: the cingulate gyrus, the hippocampus, and the amygdala. And the limbic system in its entirety controls emotion, behavior, long-term memory, and olfaction. You're like, well, that's an interesting combination. But let me just give you a story. I mean, so it's fall. I think of fall, it's like Halloween time, and then it's like Thanksgiving, right? I feel like it's like bam, bam. So it feels like fall, right? I wore my fall tie. Thanksgiving's like around the corner. It felt like fall this weekend. It was cold. And if you think, and for some of us, I'm just going to pretend all of us have good memories of Thanksgiving. Okay, and I understand that's not the case for everybody. And I'm sorry if that's not the case. But the same will apply to you if you have bad memories of Thanksgiving growing up. But if you have good memories of Thanksgiving, and there's a certain smell that you walk into the house and you're like, wow, grandma's here making fill in the blank. Mom is here making, dad did his famous stew. Never liked it as a kid, but now I do. There are certain smells that will bring back memories like that. And that's the limbic system. So olfaction or smell and long-term memory are intimately connected. Those neurons are literally right on top of each other. And that's why a smell will bring back memories that you're like, wow, I smell my grandma. like someone's got grandma's perfume on, right? You're like, what? They even make that anymore? Right? So the limbic system, smell, olfaction, memory, and emotion. Because there's an emotion tied to that memory, and that's what makes a memory stick forever. A smell and an emotion will convert it to long-term memory in the limbic system. And that's essentially, everything in blue here is part of the limbic system. And it's all really, purple, all really close together, right? They're all really, really close together. So here's the amygdala, right here. Here's the hippocampus, right here. And the cingulate gyrus is right here. So all really, really close together. Okay, cerebral hemispheres, left and right. And this is the last topic that we're going to cover today. So the left side really kind of focuses on language and reasoning. And the right side is where you get a lot of like imagination or artistic capabilities. Now, we all have both centers and they're connected by this corpus callosum. It's not that one person is left-brained and has no right side to the brain, okay? But there's a lot of interest in the neurosciences, in psychology, on left and right-sided thinking. Okay, so you can see some of the usual suspects on the left side of the brain. Logic, detail-oriented, facts rule, words and language, math and science, pattern perception, reality-based, safe, works alone. On the right side, the right centers on the right side of the brain are where we have, feeling or big picture ideas, imagination, symbols and images, philosophy and religion, spatial perception, fantasy or imagination, risk-taking, working in groups or social aspects. It's not that some of us don't have one side of the brain and some of us only have the other side of the brain, but we definitely have these areas. You kind of see the map of where these centers actually lie. So another myth that I wanted to kind of debunk today, we use all of our brain, and we also use both sides of the brain, which is really, really important. And this corpus callosum is the myelinated white matter that connects the two hemispheres so that you could actually do both, right? You can actually be a math and scientist, but have a religious preference, right? And you can actually operate in both of those venues all at the same time. Have a conversation on religion, but actually talk science at the same time. They're two sides of the brain, but isn't it interesting that we like to say it's just one or the other, right? And that fits for a lot of different topics. Okay, we're going to stop here, pick it up on Wednesday, and I hope you have a nice evening, but pause for a moment because you're going to need something.